Hi, Mary. I'm just going through the first coding assignment individually with students. So with this, let's go ahead. Number 1 was given to students. Are going to dig right into number 3. Okay, a couple of things that I want you to remember. Number 3, it looks like you coded the adverse effect first. The manifestation adverse effect was responsible for the admission. Keep in mind when it's an adverse effect, you code what is wrong with the patient first, and then the T code second. So this will be really important to remember for the exam. And then we have malignant neoplasm of the testes. It looks like you remember to make sure you do, there should have been an excision code. Okay, let's go ahead and move on to number 5. With number 5, the first code should be the B20. HIV is current, it's active, it's AIDS. Okay, so with the HIV, when they have something related to it, like the histoplasmosis is related to the AIDS takes precedence, and that should be the principal diagnosis. It should be the B20. So the other thing to remember also is that if a patient has, let's say, pneumonia, and the pneumonia, again, the AIDS is causing pneumonia, they get admitted because of the pneumonia, but it's related to the AIDS is going to be first again, the B20. Now, if a patient has a fracture, let's say they have a shaft fracture of the tibia fibula, not related to the AIDS, then the fracture becomes a principal diagnosis. So on that note, we have the B20, the histoplasmosis second. We need a D70 for other drug-induced. We have the T code for number 5, adverse effect of antiviral drugs, and then insertion for the infusion. So off on a few, read through this. I'm going to add this to all the assignments. Number 7, once again, it's really important. If you don't have this correct on the test, they will be wrong. But with poisoning, T codes need to come first. Then whatever's wrong with the patient will come second. And then, of course, we have our respiratory ventilation and the insertion of the endotracheal tube. So it also looks like on the poisoning, I have 1 where you have 5. We're going to go with unintentional. I don't know if you went with undetermined, but the only time you really use undetermined is if I don't have documentation. You're going to assume that everything is unintentional. The biggest thing here, poisoning, T codes first, what's ever wrong with them second. Same thing with adverse effects. What's ever wrong with the patient is first, and then the T code. Okay, so let's go ahead and move to number 9. That looks great. You have the nausea first, then the T code. Once again, check your 6 character out. Okay, let's move to number 11. That looks good. We do need a T code for the adverse effect of oral contraceptives. Your T code, I'm not sure exactly what you have. Do not worry about the x-ray. We do not need that. I always tell students anything non-invasive for hospital inpatient, do not code. Charge master is going to pick that up. The only other thing with number 11 is that you have a sign or symptom code, and you do not need that. All right, so let's go ahead and move to 13. Poisoning code needs to come first. And then we have the alcohol abuse code. So we have 2 poisoning codes, and we have a toxic effect code. So 15, we have the S code first, the T code in there. You do code the nausea and the retention of urine. I'm going to move this over because that is adverse reactions to the morphine. So this is a time that you are going to put those signs and symptoms in there. Repositioning, you do have that, so good job on that, but you are missing, some other codes on this. Okay, let's go ahead and Good practice. I'm giving you all the answers to chapter 20. So I would go through and maybe try to practice a few and then come back and check your answers. So number 1, we have the T code. One thing, you have the 2 N codes there. Those were not with this admission. So make sure you read through everything that I have so we do not code those because they weren't present during this admission, not addressed. Your 0 procedure code looks good. Number 2, dislocation, you're off a little bit, but overall looks good. Number 3, I've had quite a few students with the M code. Keep in mind, we are looking, it's just going to be for the infection or complications. So we're going to come up with the T codes on these. And then with this one, we had a lot of procedure codes. Number 4, we have the inflammatory conditions of the jaw, which you have correct. We have some other codes. We have an excision that also go along with number 4. Number 5 looks good, just missing procedure. And number 6 looks good. So overall, remember your sequencing is huge. You're missing some procedures. Like I said, I'll attach the answers. I would definitely recommend going through a few of these problems.